identification. This purports to be a facsimile transmission from Dr. Becker, which appears to be undated. Do you recognize this document, sir?
I don't recognize the document, but I recognize what I said.
Did you send out this document?
To the best of my knowledge, yes.
Now, I know where it says to, there's some writing which crosses out who the intended recipient is. Do you remember who the recipient is or was?
I've been curious about that myself.
So you don't know?
Do I know?
Yeah.
Yeah, I know.
Who was it?
Guy.
Okay. He was G-U-Y?
Guy. G-U-Y.
Okay. He's with Eurotechnic?
He's with what?
Eurotechnic?
I don't know what he's with.
Who is Guy? I mean,
Guy is a guy that I met through another Frenchman about 30 years ago that I've seen maybe 2 or 3 times at dental meetings. He was a friend of mine, another French guy. Dentist, he's a dentist in France.
Okay, so he became a friend of yours in some way, or
no.
What were the circumstances surrounding your meeting him?
I met him through a friend of mine. He's a friend of this friend of mine. He's an acquaintance, I would not call him a friend.
Have you ever purchased implants from him?
No.
And do you know why the date is crossed out here?
I assume you crossed it out.
I didn't. Okay. So you have no knowledge how it happened?
No.
I mean, for the record, this document is bearing a Bates number that is a production number that plaintiff uses. So this was apparently a document produced by the plaintiff.
Okay, it's number 308. Now, let's go through it. It says, nice hearing from you, dear. Crossed out, nice hearing from you. What had you heard from Guy?
It must have been, to be honest, I don't know. I don't remember. But it must have been something to do with either the Sargon implant or this trip to Monaco or this Monte Carlo or whatever.
You'll note that at the upper left there appears to be some fax information, and it has a date of, appears to have a date of March 9, 98. You see that? Up in the upper left?
Yeah, I do.
Do you believe that this was sent sometime around on or about March 9, 98?
I don't know.
And I take it you're assuming that this is using the American system of dating as opposed to European. You're assuming that 3 means March. That 3 is the month, and then the 9 is the date.
Yes, I was. It could be September 3, 98, I guess. Do you know what it was?
This was dated. There should somebody scratched off the date, but if you can resurrect it, the date will be on it.
Do you have the original of this?
No, I don't keep this stuff.
Or a copy?
No.
You don't, customarily, you don't keep copies of faxes?
This is just no. Or emails.
It says, I think you are referring to the Sargon dental implant. Do you recall what was being substantively said about something?
I don't.
It says this implant is currently being tested at USC. It says I would be very careful. And then it says, from what I have seen, it may work in the maxillary anterior region. You see that?
Correct.
What is that based upon?
Well, I saw one implant in that patient, and I think that I saw a presentation, like I previously mentioned, by either Nazari or Sir Winston, that's where the implants were.
You believe you saw a presentation from either Nazari or
Maybe he's at the USC
Chi,
symposium.
Wait. Nazari or Chi?
in which one of them, or both of them, said that the implant only works well, or only may work well, in the maxillary anterior region?
That
The
is what
objection
this
that,
says.
excuse me, the objection that misstates his testimony. You can answer.
That's not what this says.
Okay, it says it may work in the maxillary anterior region, correct?
Correct.
Was that sentence made to rule out that it may work in other regions?
No.
So it may work in all regions, correct?
I don't know.
Well, what was if it may work in all regions, what was the purpose of saying it may work in the maxillary anterior region?
Well, objection asked and answered. You can
If I
answer
see
again.
a slide demonstration and the implants are only in the maxillary anterior region, I make the assumption that that's where it's being used.
But it doesn't say it may be used, it says it may work. Is work in that sentence the same as may be used?
I think we're splitting terms. I don't want to get into that.
No, I just want to make sure we're not talking about work versus not work well versus not work well.
No, what this says, it may work in the maxillary anterior region.
And did you have any information as to whether or not the implant was being placed in other regions in the USC study?
No. None.
So as far as you knew, the implant was being placed in all parts, in all regions of the patient's mouths.
I
correct?
don't know.
Objection, it calls for speculation, and it's asked and answered.
Did you ever ask anybody what regions of the mouth the implant was being placed in the study?
No.
In your conversations with Dr. Landesman about this implant, when he was so enthusiastic, did he tell you that it was only being placed in the maxillary anterior region?
No.
Did he limit where it was being placed at all?
I don't think we ever had that conversation.
Then it says, but the prosthetic parts are kind of shitty. You see that?
Yes.
First of all, is that the kind of language that you customarily use in communicating with other dentists about a product?
From time to time.
And the sole basis of that statement was the observation you made of the student and his difficulties with the temporary prosthesis?
Objection calls for, it lacks foundation. Are you asking him that's the only implant he personally observed? The only Sargon?
No. I'm sorry. My question is, was that incident the only factual basis that you relied upon in making the statement in this fax that the prosthetic parts are kind of shitty?
Correct.
Now, Doctor, you consider yourself a well-renowned, nationally known dentist, is that correct?
I don't know. I'm known. I don't know if how renowned.
Well, do you think it's appropriate? I mean, you would expect that anybody who hears some kind of a statement from you would put credence into that statement because of your reputation. Would you agree with that, Doctor?
Objection calls for speculation and lacks foundation.
No. I don't agree with that.
I mean, I've looked at your CV. I mean, you must be, tens or hundreds of articles publications you've made, speeches you've given. You're invited to go around the world to give speeches. I mean, you're not just your regular dentist in a storefront office, are you, Doctor?
I don't make judgments on
Objections.
my own, what I am. I mean, what I am. It says it in the CV. This is a personal judgment that I made in a personal fax that was not disseminated with my knowledge to anybody other than this person. And I think I have a right to an opinion, a singular opinion,
and you think it's appropriate for you to make comments about another product, the parts of another product, that they're shitty based upon seeing a student on one episode have difficulty with a temporary restoration. Is that correct?
Objection is argumentative.
I'm asking if it's appropriate. Is that correct?
I don't think it's inappropriate.
It's not inappropriate even though you knew nothing about the student's training, correct?
I assume he's in a residency.
You know nothing about his training in the Sargon dental implant.
Correct.
Okay.
Objection, that misstates his testimony.
You knew nothing about the manner in which the prosthetic, the temporary restoration was put on, correct?
Correct.
You don't know if it was put on in violation of the protocol or of the Sargon system's own guidelines, correct?
Correct.
And you didn't take any efforts at all to investigate any of those factors, correct?
Correct.
And yet, you disseminated to a dentist that it was shitty. What did you think that the dentist would think about the prosthetic devices on this implant upon reading your fax?
Objection, it calls for speculation as to what another dentist or any other person, for that matter, may think upon reading a fax from Dr. Becker.
Did you consider this a positive statement about the Sargon dental implant?
Objections, vague and ambiguous. It's the word positive. You can answer if you understand it.
I don't think you used the word Sargon implant. It most certainly is not negative about the Sargon implant.
But it certainly is negative about the prosthetic parts that constitute a part of the Sargon implant system, correct?
Well, objection, vague and ambiguous as to the word negative, and calls for speculation.
Now, you mentioned that you felt you had a right to, make whatever statements that you wanted to make. Do you think you had a right to unjustifiably and unreasonably disparage the Sargon dental implant system?
Objection, argumentative, lacks foundation, and vague and ambiguous.
I think it's quite clear that I did not disparage the Sargon implant system. We were discussing one component of that system. And there's nothing disparagingly at all regarding the implant.
Did Guy, I think it's Guy, did Guy request your opinion about the Sargon dental implant?
To the best of my knowledge, he emailed me and asked me.
And did he request your opinion because he was considering whether or not he wanted to use it in his own practice?
Objection, calls for speculation.
Well, I'm asking what...
I don't know.
Well, was he only a dentist, Guy, or was he also a distributor of dental products?
I don't know about dental products.
And then it goes on to say, be careful of these immediately loading concepts. We have tried a few innovation and fell on us. Okay. What was the concept? We say the immediately loading concept to be careful of. What in particular? What concept is that?
It doesn't, excuse me, it misstates the text here. It doesn't say concept, it says concepts. It's plural.
Yeah, that's what I meant to say. What concepts were you advising Guy to be careful of?
Should we answer?
Yes.
Well, this was
well, objection. It assumes facts, not an evidence. It assumes he's advising him on anything, but
It's right.
that he's advising him on something.
Well, okay.
Oh, okay. Well, prior to this is a major paradigm shift here with this concept of immediate loading, and most of us that are involved with implants, and I'm sure Dr. Sargan would feel the same way, require on a certain body of evidence to be presented in a peer-reviewed manner before we take off and start doing new things to our patients. So, and that applies to me as well as others, and that's exactly what I meant by that statement. Prior to this time, it wasn't usual to be, that to my knowledge, to place implants and restore them the same day or within a day or two.
So you meant to say, be careful of these immediately loading concepts because there is no data yet to support that concept?
No long-term data.
How come you didn't say that? Mention anything about data in this letter?
Well, this was not meant to sit in front of a deposition. I was just responding to a question, and if someone had asked me a lot more careful manner, I would have written them a letter. But that's what I think is any reasonable person would deduce from this note, is that there's no data at that time. There were no data to support this concept.
Well, doesn't the absence of any reference to lack of data, wouldn't that lead a reader of this to be careful of the concept because it's not a good concept, not because it lacks data?
Objection. It calls for speculation as to what it would lead a reader to think. Or
isn't that what you were trying to convey to this person, that to be careful of this concept, not because of data to support it, but because it's not a good concept? Is that accurate?
Objection. It misstates the witness's testimony and it misstates the text of the document. The document speaks for itself.
In saying that.
Wait, I'm sorry.
I'm asking if that was his intention in saying it.
No.
Then why would you then say we have tried a few innovation and fell on our ass? What was the purpose of saying that?
To let them know that we've tried a few immediate loaded implants and that they didn't work. It's informative.
Did you also want to mention anywhere in this letter the fact that Dr. Landesman was very excited about this immediate load implant?
Objection. Argumentative.
Where does it say that?
I'm asking you, it doesn't say that. Is there any reason why you didn't put in that other people, however, are excited about this implant?
He didn't even know Dr. Landesman, to the best of my knowledge.
Well, he knew USC apparently because he referenced it in the letter.
Hold on. I don't think there's a question.
No, there's not. So did you mention, did you want to say anything in here about, why didn't you say, we have tried a few innovations that fell on our ass, however, others at USC appear to be very excited about this implant? How come you didn't say that?
Well, that's kind of speculation. I don't know. Why didn't I do a lot of things? Why didn't I buy a different car rather than an Explorer? Why don't I have a red tie instead of a blue tie? I mean, I don't have an answer for that question.
Now, when you say we, who's the we you're referring to?
Where are you?
It says we have tried a few.
Oh, my brother and myself.
And what are the few, I assume I should say innovations, not innovation. Is that correct? I should say innovations. Is that correct?
Go ahead.
Okay. What are the few innovations that you and your brother tried?
Well, there were two instances. One is that one of the implants had the provisional placed the first day, and the other restoration was placed within, say, 4 or 5 days of the implant placement.
That's what you already testified to before.
Yes.
And that was with the Brannemark implant.
Correct.
How come you didn't mention in this letter that you tried a few innovations with the Branimar implant and fell on your ass?
Again, objection. It calls for speculation.
There's an assumption that he knew I was using the Vandermark system.
Or were you attempting by this sentence about tried a few innovations and fell on our ass to make some comment in regard to the Sargon dental implant?
Of course not.
Well, I don't understand, doctor. Apparently you get a inquiry from a dentist asking you about the Sargon dental implant, and you mention in that letter that you tried a few innovations and fell on your ass, but you don't point out that the innovations were tried on the Branimar implant. Do you think that was deceptive at all, doctor?
Unequivocally, no.
As of the date that this facsimile transmission was sent, had you been to USC and seen the surgery that you referred to? Do you recall whether or not how the timing works out?
I think the surgery was afterwards, but I'm not sure. This is I don't know when the Monaco thing was, but I think I saw the surgery after the Monaco symposium.
For the record, the document is not dated.
Did you ever talk to communicate? I'm sorry, I'll wait. It's okay to.
Yeah, go ahead.
What prosthetic parts are being referred to here as being shitty? What particular prosthetic parts are you describing as being shitty?
The provisional parts.
What in specifically?
I don't understand.
Well, is there just one part, one prosthetic part, or provisional part?
I don't know.
Well,
I only saw the one that was on that restoration. I didn't see the provisional part. I saw the provisional and assumed that it was on some part, but which part I don't know.
Do you know how many prosthetic parts are in the Sargon implant system?
No.
And which particular parts were shitty?
Oh, the objection asked and answered.
I apologize. I don't remember the answer. Which particular provisional parts are kind of shitty?
The part that the provisional was attached to.
Which was?
I don't know which part.